Hey, I'm here with my health colleague, Dr. Tim Linker. Dr. Tim serves at the YMCA 1 day a week, and he has his practice in Mason. Where's your office at, Doc?
It is right on Tylersville Road near the intersection of Butler Warren and Tylersville.
Okay, and you've been around for a while, and
Been down there about 6 years, yeah.
Got a new associate in, so
Yep.
been helping people for a long time. What we want to talk about first is asthma. Asthma seems like it's a growing epidemic with young people, and you know, is there a fear, I think, with kids getting involved with exercise if they have asthma?
Oh, certainly. Yeah, I think that the diagnosis has gotten better. I think people are catching it earlier.
Yeah.
And there's certainly a fear. There's a fear on the part of parents. There's a fear on the part of coaches who aren't going to know what to do with the kids. You know, I think that a lot of those fears can be allayed as long as the child is diagnosed quickly, diagnosed properly, and as long as if the child needs medications, as long as the medications are started quickly.
So do you recommend that they have an inhaler or something with them when they're
Well,
exercising?
it kind of depends. I mean, we have obviously different levels of severity of asthma. Some kids don't need a lot of, you know, they don't need inhalers except on a rare basis. Occasionally, kids will just have asthma exacerbations or flare-ups when they exercise.
Yeah.
What asthma is a reversible airway obstruction. Reversible means it gets worse, it gets better again. If we actually look inside of an airway, it would be a little tighter. There would be more gooey, mucousy stuff that kind of shows back up, and you can undo some of that. And it occurs for a lot of reasons. There is probably a genetic component to it, like most things. There are other factors. Some kids tend to have more asthma if they have allergies. The good news is that it usually in most kids who don't have a lot of really severe asthma, it's pretty reversible. Yeah. And so what we'll do is just generally, if there's a suspicion, and sometimes the suspicion is, you know what, my child just can't keep up. Yeah. He's a good athlete, he's a fit kid, he always falls behind after the first mile, but we're not sure why. That's a way to kind of, you know, for your suspicion to kind of go up. Certainly if kids wheeze or if they get tight, you know, when they exercise, that's another, you know, kind of red flag. But there are pulmonary tests that are easy. They're non-invasive. There's really no risk. The kids basically blow into a computer. It looks like they're smoking a cigar. They blow in and out of a computer, and that tells us how much the lungs inflate, tells us if there's any reversibility to any obstruction that may be there. The good news is the medications actually are pretty good. Kids are doing a lot better with asthma. A lot of kids I'll just have use an inhaler a half hour before they go out to exercise, and that's plenty for them. There are other kids who need more therapy, and that's kind of where we earn our stripes a little bit, taking care of those kids, make sure they can, you know, they can stay active safely.
Are there common food allergens that contribute to the symptoms of asthma that parents might need to look at or be aware of? Or?
Can you re-ask that question? My battery's... Okay, go ahead and just start with asking me that question again.
Are there certain food allergens that are common that contribute to asthma that parents might look at as a factor in this?
You know, people who tend to have allergies are more likely to have asthma in general. People will have more eczema, like the kind of generalized dry skin rash, and that kind of tends to run together. Not always, but you tend to see kids have more airway issues if they have more allergy issues. Not always, and it can be kind of tricky sometimes. But to answer your question, you know, certainly if the kid is reacting to anything at all, if there's any kind of food issues, or my child just gets hives for no reason, or you know, he has itchy, scaly rash that shows up in the wintertime, if there's a concern, it probably isn't a bad idea to even look at talking to a pediatric allergist to see if there's any. They kind of go hand in hand to see if there's any issues with that.
Do kids grow out of the asthma in some cases,
you know,
or is it something they have to deal with for the rest of their life?
In some cases they kind of do. A lot of kids will have, it's not true asthma, but they will have airway obstruction. Kids will catch a cold and will wheeze. I'll see kids in the office who are wheezing, and it sounds like asthma when I put a stethoscope on them, but what's actually happening is their airways are just constricting down a little bit. It kind of behaves the same, but a lot of those kids will kind of progress out of that, I think. You know, the main thing is just awareness. If kids know they're asthmatic, they need to have the inhalers with them at sporting events. You know, and they also have to understand too that the inhalers, if kids are having to use them more than a couple times a week, it means they need something else besides that little rescue inhaler. So I hear kids and adults say, yeah, I use my inhaler every day.
Yeah.
It means you're not on enough medication. It means you need to have a daily medication or even a daily inhaled, like a steroid, for example, which will keep all the inflammation down on a pretty steady basis, so you don't need that rescue inhaler all the time.
Now, the inhaler, is it a bronchodilator, or is it something
It
that
is.
stimulates the airway to open up?
Correct. Yep, exactly. And they come in all different flavors, but the what we call the rescue inhalers, the albuterol classically is the one that you take it, and within 5 minutes or so, your airways kind of open back up. There are kind of longer-acting inhalers. There are inhaled steroids, which kind of have become the mainstay. There was a lot of fear for a long time about using inhaled steroids in kids. We thought we were going to stunt their growth, and there's all kind of we're not really seeing a lot of growth issues with steroids. We think that they're pretty safe, and they've kind of become the mainstay for kids who need help breathing.
Now, is there a danger in them abusing the inhaler too frequently, or if they see that they're using it more? They probably should go talk with their medical doctor to make sure they get their meds checked.
Exactly. I think if kids are using it more than twice a week, or adults, I think they probably need something else. Because we kind of stratify asthma by how severe it is, and part of the severity is based on how often you need to use your medication. It's funny because that medication, it doesn't work instantly. I've seen kids, you've probably seen it at wrestling matches, where I've seen kids, they come off after the first period, and they say, I'm short of breath. They take the inhaler and go, okay, I'm better now. And then they go back out and wrestle. It doesn't work that fast. There's probably some placebo effect to it. Probably, probably some deconditioning. Kids just aren't in good enough shape. But it really will work within about 5 minutes or so.
What about stress or anxiety? Is that a trigger sometimes, to trigger an attack? Or?
Certainly, yeah. Yeah, certainly. And there's all kinds of, and I think that's the key, is identifying your trigger, whether it's cold air, whether it's certain things that you're allergic to. There are all kinds of things that can potentially trigger this. And I think the older and more mature people get, the more they kind of know they need to avoid certain things.
Okay. So if parents are suspicious of their kids perhaps having asthma, they can get into your office, have that test done.
Absolutely.
And pretty easily find out if that's the case or not.
Yep. Yeah, in most cases. And obviously, if there are people who we have questions about or are uncertain of the diagnosis or just need some additional help, we then would refer kids on to the specialists.
Okay.
But the majority of kids, the pulmonologist would probably kill me for saying this, but the majority of kids with kind of the garden variety asthma or airway obstruction probably don't need to go down to Children's to the specialist.
Okay.
Most of their family doctors or general pediatricians should be able to take care of them.
Okay, and if you don't have a family doc and you want to check this out, can you get a hold of you at the office, Doc?
Absolutely.
And what's your number down there?
It is 701-5510.
Hey, I'm grateful to have Doc Tim Linker in our community. So if you got a question about asthma, give him a call or give your medical doc a call. Get it checked out. Don't mess around with it because it's something serious.
Absolutely.
Doc, thanks for
Hey, my
being
pleasure.
with us.
Thank you.